1 in 12 people in this country, or about 25 million, have asthma. Asthma can be a debilitating and sometimes life-threatening illness that can severely impact the quality of your life. Just imagine how frightening not being able to take your next breath would be. Dr. Yang Ahn, director of the Ahn Medical Clinic, is the Ahn Clinic for Medical Acupuncture, is here to explain what causes asthma and what you can do about it. So good to see you. We know what it is. It's that wheezing sound. It's that shortness of breath.
Right.
But what causes triggers for asthma?
You inherit asthma genetically. It runs in the family. And when the asthma gene gets triggered and activated, and it becomes very sensitive, like you said. If it's the normal size of your bronchial tube, it's this much, they constrict. You know, like response to the just dust we have all over the place, and the pollens. Then animal danders, sometimes cold temperature can do that. Sometimes the exercise can trigger that.
Absolutely. So there's so many things. So what are the typical ways of treating asthma? Well,
they're like anything else in the medicine, try to avoid it. But, you know, Arizona, you cannot avoid the dust.
Right. That's true. It's everywhere.
Yeah, and this spring, like now, you cannot avoid the pollens and things like that. So in Western conventional medicine, we have inhalers. Sometimes combination inhalers called the bronchodilator, mixed with the steroid. Advair, Symbicort, combination of the sales worldwide, $10 billion, which is a good medicine, but it never cures the asthma. It never cures it.
You'll see people, if they're in an attack, they'll take that inhaler to open up the lungs very quickly. But it is a steroid, and for a lot of parents, including myself, who have small children, pumping your kid with steroids every day is very, very scary.
That's correct.
So what are some other alternatives? What is a natural way?
The natural ways? Well, of course, acupuncture. The thing is that the acupuncture is not just to relieve the asthma, it cures. And there's no medicine, no side effect, no pains. And 80% of the patient with an average 3 to 5 treatment, it cures, and you don't have to worry about it.
And if you have a child, that's scary. Needles can be scary, but you said that there's little ones that you have that with pediatric asthma.
You're right. Josie is she's a 2.5-year-old.
Right.
Yeah, with the full treatment, she was taking a nebulizer 3-4 times a day. And she's not taking any more. All
right. Well, the Ahn Clinic is open to you for a free consultation. Remember, Dr. Ahn is on 24/7, answering your questions personally at 480-515-2000. You can also go to their website, ahnclinic.org. And coming up, you are going to meet a patient who could barely do any physical activity without aggravating her asthma. Well, now she's doing jumping jacks, inhaler-free. You're going to meet her coming up, Terry.